From Meals on Wheels to help with washing and dressing, social care helps to keep the elderly and the disabled at home. But those services are among the many under pressure in what health campaigners describe as the swingeing cuts that have left nearly 1.5 million people without the support they need. Now, 150,000 members of the public have signed a petition backed by health leaders calling on Boris Johnson to take urgent action. Our social affairs correspondent, Alison Holt, reports from Hertfordshire.
Hot food delivered to your home, a simple but vital part of helping people who are older or disabled stay independent and well. Here in Hertfordshire, they believe Meals on Wheels help keep people out of hospital. But in the last decade, many councils have cut this sort of early intervention service as they've struggled to balance their books.
I've got your lunch for you.
79-year-old Edna Clark started getting these visits after spending 4 months in hospital. She ended up there after falling ill and losing a lot of weight. Because she's partially sighted, she was struggling to prepare food.
I couldn't see the gas ring, and if I used the front one, I could have crossed over and burnt my arm or set me clothes tonight. So when I went to hospital, I told them, and they said, you can have Meals on Wheels.
Edna, have you got any tablets to take today?
Yeah.
We have to invest in prevention. We have to give this support to people at home if we're really going to make inroads into saving the money which the NHS is going to keep needing. You know, people are getting older and the ageing population is growing.
Today's petition makes it clear families and health services are buckling under the pressure of a care system that can't provide enough support.
The current crisis is having a terrible effect on individuals, elderly people and people with disabilities who are not receiving the support they need. But alongside that, unless we get this right, the health service itself will not be able to cope.
10 years now into austerity.
But more hard decisions lie ahead. The short-term government grants which have allowed Hertfordshire's Director of Care Services to keep Meals on Wheels end in March.
Ultimately, if we don't have the money, then what we've got to buy are care home placements and home care rounds for people who don't have anyone in the world. And that will mean we've got to prioritise that and therefore, by definition, deprioritise Meals on Wheels.
It's a situation that makes no sense to those at the sharp end.
What do you think would be the effect if you weren't about, if you weren't doing this, if you weren't providing meals?
I would personally say it would be an absolute disaster for the elderly. It's ridiculous really when you think about if it wasn't there, what would happen? What would truly happen to them people? As long as you don't keep the football on.
The government says extra money has been put into social care and that the Prime Minister is committed to fixing the system for those that need it as soon as possible.
Bye now. All right, you take care of yourselves.
Alison Holt, BBC News, Hertfordshire.
Thank you. Bye.
In Scotland, life expectancy improved